So you have studied Ayurvedic medicine, and these years take a major part of your life. Once you become a doctor, you are committed to healing. And to be a great healer, learning has to become a never-ending pursuit in your life. So doctor, what are you doing to continue this learning?
A very warm welcome to all the doctors, students and practitioners for this Acharya Rasayana.
Learning experience for everybody, even for me also, isn't it? So there is no end for learning. So that's what actually I believe.
Today's subject we are given is psoriasis.
Clinical dermatology.
If you use Vamana on yourself first, then you will believe that it will help.
Spending few hours with a scholar is equivalent to months of time spent reading books. In the name of Acharya Rasayanam, we are bringing excellent minds on Ayurveda with rich expertise in clinical practice. The purpose of this initiative is to guide and uplift the confidence and clinical expertise of every Vaidya. There is a saying, if you cannot be a king, the next best thing is to become a healer, because you are changing people's life, and that is the power of a Vaidya. Acharya Rasayanam is an Ayurvedic practitioner's only CME program initiated by Sitaram Ayurveda's 100th year celebration through Sitaram Research Foundation. Sitaram started its healing journey in the year of 1921. Being a pioneer in Ayurveda, Sitaram extends the healing powers through a state-of-art GMP certified manufacturing plant, government approved R&D laboratory, super specialty Ayurveda hospital, and an NABH accredited Panchakarma retreat. By attending Acharya Rasayanam, you will get the opportunity to get valuable insights on clinical practices, various methods and techniques prevalent in the Ayurvedic medical fraternity from the best scholars. You will be receiving the show notes, certificates, webinar recordings, and the latest updates on your email and WhatsApp. To receive latest updates and newsletters, please send a text to 89434 41881. For more details, log on to our website www.sitaramayurveda.com. Acharya Rasayanam. Great practitioners invest in learning.
Good morning. A warm welcome to all of you to Acharya Rasayana. Today we are having our 147th episode of Acharya Rasayana, a series of CME conducted by Sitaram Research Foundation and Sitaram Ayurveda Pharmacy Private Limited. Today our topic is on Manasika Rogas, traditional practice by an expert clinician. Today we have an eminent speaker, Dr. K.T. Jayakrishnan sir. He's a Group Medical Officer, Triyog Ayurveda Hospital, Chennai, former Professor, Ayurveda College, Coimbatore. Welcome sir, welcome to Acharya Rasayana. The session will discuss on applied aspects in daily practice, general disease based on psychiatry, case discussion, and clinical experience. And today, our moderator is Dr. Ramya ma'am. She is MD Ayurveda, Vice Principal and Professor, Department of Panchakarma, Ashtagam Ayurveda Vidyapeetham, Palakkad, Kerala. Welcome ma'am, welcome to Acharya Rasayana. And chair of the session, Dr. Ramanathan sir. Welcome sir. And last not the least, I welcome all the participants who are presenting here for Acharya Rasayana. Handing over to Ramya ma'am.
Chaturmukha Samarambham, Vakpatacharya Madhyamam, Asmadacharya Paryantam, Vande Guru Parampara. Ragadirogan, Satadana Shaktana, Sheshakaya Prasadana Sheshana, Utsukya Moha Ratitan Jagana, you are Puru Vaidyaya Namostu Tasmai. A very good morning to one and all, respected Ramanathan sir, respected Jayakrishnan sir, dear Dr. Rashmi, all others and all our participants. Once again, we are here together on a Sunday morning to discuss a very relevant topic in our day-to-day practice, the so-called Manasika Rogas. So, as we all know, I think in our treatise, there is no exclusive section for psychiatric disorders. We know it's coming under, we always wonder, it's just put under the topic of Unmadam, maybe an Apasmaram. And Acharya speaks about Manas, and he says Rajas and Tamas are Manodosham, and then Deham and Manas are Adhishthanam of Rogas. then nowhere he specifically details about manas or manasika issues in a detailed way. Other than, but we do understand in Sadhaka Pitta's role, in Avalambaka Kapha's role, in Vyana Vayu's role, all these things, manas is being taken care of functionally or clinically. So, but the fact remains that today we live in a society wherein you have so many ICDs coming under psychiatric, right? From schizophrenia to anxiety to bipolar to maniac, etc., etc. All these things coming under us. How to deal with these things in day-to-day practice, where our acharya is not aware of this, or is it like Ayurveda was basically meant for Sharira and Manas was with the background of Yogam, Darshanam, etc., which a Vaidya was already supposed to be exposed to or supposed to be aware when he comes to learn Vaidyam. Is this was the tenet of understanding Vaidyam with respect to Manasika Rogas in earlier era. I think all these things are many thoughts or queries that in one or the other stage of life, each one of us might have thought over, at least when we start practicing. In that context, we have the right person with us today to discuss this area of Manasika Rogas and dealing in clinics, Dr. Jayakrishnan sir. Because I know Dr. Jayakrishnan sir through his many students whom he have inspired in Coimbatore College as well as college in Chennai, and his fundamental grip on the fundamentals of Ayurveda, and whenever he deals with all the cases. And when we think of our manas, we all know that, the Indriya, Sharira, Sattva, and Atma forms the Jivitam in Ayurveda. And when we see that in Katita Purushiyam Charaka Sharira, it is very specifically mentioned with Manas is with Karma, but Achetanavan, and Atma is with Chetana and Akarmavan. And whenever it is almost together, almost always together, that Atma and Manas come together in the form of perception. And for us to treat cases in terms of understanding Manas, in terms of understanding Atma, we really need to have great insights. So I think in that aspect, we have a very experienced, staunch clinician with us to discuss the intricacies of Manas and treating Manasika Rogas. So on behalf of all of you over here, and on behalf of all of us over here, with all love and respect, I invite Dr. Jayakrishnan sir to share his insights on the topic and his clinical expertise in the area, so that the younger generation or S2 practitioners are guided more in this area and they become more and more confident in dealing with these cases. So with all your permission, I invite Jayakrishnan sir to the session, which will be followed by a discussion. Sir, please. Namaskaram.
Namaskaram. Good morning to everybody. Today's topic of discussion was deliberately selected by me itself, suggested by me itself, because of a few reasons, Firstly, I think we are not exposed to the understanding of mind, even though it is a inevitable part of your day-to-day practice, day-to-day life. Mind is essentially an inevitable part. Whether there is a disease, whether there is a normalcy, healthy status, mind is playing a very good role in day-to-day activities. To that much understanding, to that much clarity, mind is not very clearly explained in Ayurvedic text. But mental diseases are explained. Mind is not explained. So what happens is that, Ayurveda as a whole, we all know that our course is designed in such a way that you understand the normalcy of the body. If normalcy is understood, deviation from normalcy will be easily understood. Deviation from normalcy is known as disease. If normalcy is understood, then only you can understand the deviation from normalcy. Based on that, you have a plan to deal with that deviations or disease. That is treatment or management of the disease. So this is when we try to understand what is the normalcy of the body, then only we understand what is a disease process. If we understand these two, then a plan for managing that condition will be clearly initiated. That is a chikitsa. And that is how our course is also designed. Medical education, right from the beginning, it is designed in such a way. So as far as mental disease is concerned, we must look back and introspect and to see whether we know what is a normalcy of mind, or rather what is a mind. What is a normalcy of the mind? If you know what is the normalcy of the mind, then only you can think of what are the dysfunctions that you can expect in the mind. If the dysfunctions are understood, gradually you understand what are the possible disease modulations in the mind. Then only you have an option to see how it can be managed. So these are the areas, these are the thoughts I have been having right from beginning as a student, then as a teacher. I was trying to find out the answers for that. So we know that most of the Samhitas talk about disease and its management. Reason is very clear. Samhita Acharyas thought that you all will be knowing what is a mind, because a mind is explained in not logics, darsanas. So most of darsanas you have the explanations of mind, or rather the mind is explained more clearly in spiritual books like Upanishads or Brahma Sutram of Shankaracharya and all. You can see a better explanation of mind. Logical explanation you can see in most of the darshanas, Shat darsanas. So Acharyas think that you study darshanas and then you enter Shastra. That was the older method. You study Sanskrit, then Tarkam, Nyayam or any darshana. Then you study any of the Shastras. So Shastra Acharyas think that you already know that. You are exposed to understanding what is mind, what is body, what is Atma. Then you are entering a Shastra which is basically deriving its methodology from Shastras, Upanishads and Vedas. That is why I think Samhitas, they just directly start explaining the diseases and its management. But normalcy is not same. That's why, we say Ekam Shastra Madhyano Vidya Shastra Nishya. That is usually taken as an excuse to study modern science. But in our this thing, Ekam Shastra Madhyano is actually meant for the Shaddarsanas. You must have an understanding of Shaddarsana, where we try to look at this world, the physical world, through a particular method of thinking. A thought process is applied through which you look at this world. That is what is basically described in most of the Shastras, in which I used to put an extra importance to Sankhya. Through Sankhya, Sankhya says, what is a method of understanding, looking at this world. In the same mode, you need to look at the individual body, individual mind, and if there is anything beyond the mind, that also has to be understood from this method of thinking. So that method of observing this world, method of understanding this world, that thought process is given in darsanas. And that methodology of thinking is very much relevant in understanding the Ayurvedic Shastra. So you develop a method of thought process, and through that thought process only you try to understand what is an individual. It's not body alone. So individual as a physical body, deep to the physical body there is a metaphysical mind, and deep or above all physical and metaphysical plane, there is a person who is using this metaphysical mind and the physical body to live here for a limited time. In very brief, this is understanding of darsanas. I would like to say that darshanas are a way to explain the physical world. That method will be always connected with what is described in Upanishad, what is described in Vedas. Or it cannot disagree with what is described in Upanishad or Vedas. This you can very easily see when Charaga gives a separate chapter on Purusha. You say Shaddhadu Purusha, Kalda Purushiyam, chapter Shaddhadu Purusha, Egadadu Purusha, Chadurvimshadi Purusha. Okay. So when you say Egadadu Purusha, he means that the Purusha is living here. And that alone is relevant. When you say Shaddhadu Purusha, Purusha using the Panjabhuta body is living here. So there also the Purusha is important. When you say Chadurvimshadi Purusha, Tattvas, Panjavimshadi Purusha, where the Purusha is living here and its descent into the physical world to do the activities are explained in Chadurvimshadi Tattva. 24, you can say, aspects or stages through which the descent of Purusha into this world is explained. And this is what is happening in every second of your life. Another context, because Charaga clearly says in this Kaja Purushiyam, when he describes Purusha, he says Sa eva prakriti. Purusha himself, on his descent, it acquires the properties of Sattva, Rajas, Tamas, because it is descending into a world of properties, Saguna world. The first thing, what it comes from a world of no properties, Nirguna world. So the first thing it acquires is, it tries to acquire the three gunas, Sattva, Rajas, Tamas, which are partially opposite to each other, but in a balanced manner, interbalanced manner, it acquires the three properties, and that status is known as Prakriti. Okay, so Charaga makes it very clear, Sa eva Prakriti. From that only, this explanation you can see in the Sankhya Karika also, and when you say Chadurvimshati Tattvas or Susuda Samhita in the Sharirasthana, begins with the description of these things. And it implies that don't think that what you see as the body is the only thing. Deep to the body, there are many things you need to understand. So to avoid the misunderstanding, he puts it in the Sharirasthana where the body is going to be described. So we all know that when we attend the anatomy dissection and all, we all unknowingly think that we understood everything in the body after the dissection. When you enter into practice, when you deal with your own body or your own relatives, you understand. What you understand is not enough. To deal with it effectively, then enter. So that is why in Susa Samhita Sharirasthanam, he says that physical body alone is not the identity of the individual. Deep to the physical body, there is mind, and even beyond the mind, there are planes. That is very well explained when the Chadurvimshati Tattvas are explained. That is directly taken from the Sankhya Darshana, where the highest plane you have only one status, that is known as Purusha. Pura Sheyade Aneniti Purusha. One who stays in this physical body is Purusha. So he is living here. When he descends to get connected to the physical body of five Buddhas, that connection is known as, that bridge is known as the mind. Okay, that bridge is known as the mind. So mind naturally will have both aspects, the part closer to the Purusha, the part closer to the physical body. And everybody will have two planes of mind basically. The part closer to the Panjabhuta body is known as emotional mind. The part closer to the higher Purusha is the intellectual mind. Everybody will be experiencing both emotional and intellectual mind. See, Shastra is an explanation of everything from the plane of mind. Science is an explanation of everything from the plane of physical identity. So in science, you need evidence on repeated experimentation, physical evidence you expect when you are dealing with science. When you are dealing with Shastra, you don't require physical evidence, whereas you require logic and reasoning to satisfy the mind. Logic and reasoning is required to see something is working or not. So all Shastras are explained from the plane of mind, and a continuous hearing from a, what you say, very disciplined mind, you understand it very clearly. So a disciplined mind is very much essential for understanding the essence of Shastra. And this kind of conversation through the mental plane will be easier when the father is teaching the son. Or when a student becomes very close to the teacher, closely moving with the teacher, where you can easily understand how is his thought process manifested. So he is learning to understand what is the thought process of a teacher. And when the knowledge is transferred through this thought process, you call it as Gurukula. Intimacy of the student and the teacher, intimacy of the father and the son, where mental thought process is transferred, then easily any situation you will be applying the thought process. This is very much needed even in the higher learning process of sciences. Now the West has agreed with that. When you study the PhD level and all, it is not the book. It is a continuous movement with the teacher, where the thought process of teacher is transferred. In any understanding of Shastras or any Indian Shastras, this method was, I think, followed in ancient days, where the student is learning to understand how the teacher is thinking. That method is adopted, then any situation you will be dealing with accordingly. See, that is a way Ayurveda is also understood. We know that Ayurveda, you don't have all diseases explained, some limited diseases which are working as examples. So the way you understand the normalcy, disease, its management, that methodology will be applied even if there is a new disease coming up. So that method of understanding is very important, especially for the mind. So I tell you, understanding the normalcy of the mind, you need to look to yourself. When you are very comfortable, when you are very relaxed on a particular day, how is your mind? We all know that there is only one mind. We try to understand our own mind, then that method, through that method, you can analyze others' mind as well. Okay. Fortunately, unfortunately, majority of the people think mind is the world in which we are living, but it's not exactly mind. We know that everybody is doing everything for remaining happy. That is accepted throughout the world, in spite of region and in spite of religion, in spite of countries throughout the world. Everybody is living for remaining happy. Sugartha sarva bhutana mada sarva prarthaya. So what is the status of sukham? Being happy, being relaxed, being comfortable with yourself. How is it possible? In a state of deep sleep, Gada Nidra, everybody is happy. Even when there is no mind, no thought process going on, deep sleep, everybody experiences happiness. Or rather, this is happiness everybody is expecting throughout the life. To remain happy in spite of anything. So we know that in the deep sleep state, you are remaining in your natural state, mind is switched off, body is what you say, passive. Body is present, but it's not active. It is passive. Mind is switched off because there is no thought process at all in the deep sleep. Gardanidra. It is explained in Susuda Samhita, states of mind, or rather it is taken from Upanishad, states of mind in different ways. You see Swapnam, Jagra, Sushupti, and fourth state is known as Turiya state. That kind of things are explained in Susuda Samhita, but we know that in deep sleep, it's an understanding. You are happy, everybody is happy. Why there is a happiness even when there is no mind? It clearly shows that, logically, it shows that happiness is there deep inside in your status, natural status. So when you get up, when you have to connect with the external world, physical world, you extend down as mind, as I explained earlier, and then in the mind comes negative and positive thing. This is what decides whether you are happy or not. We know that everybody has got only one mind, and that mind is having one function, which is chinta. We say chintyam vijari mukhyam deyam sankalpamevacha. Chinta, thought is the basic function of the mind. Other uham, sankalpam, and all those things are extensions of thought process, results of thought process. So basic function is that through the thoughts and emotions, you know that there is a plane which is known as mind. Otherwise, you don't see directly the mind. The effort of the science to pick a structure, find a structure and attribute the mental function. Still, it is not succeeded because mind is not physical. But how do you understand there is a mind? Because you are always in thoughts and emotions. Whatever is the source of thought and emotion, you call it as mind. So mind is there through its functions, dharmas. To understand that mind is there, it need not be physical at all, material at all. So thought process is going on. Since you have one mind, you must have one thought at a time. But we know that there are multiple thoughts, many thoughts coming at different paces in different given situations. But very normalcy should be one thought at a time. Then you need to say that you are normal in mind, and you will be really happy also. When you are relaxed, when you are thinking very comfortably about anything in the world, you will be happy. This is the reason mind is normal, it is one, and you get only one thought. You finish the first thought, then you go to the second thought. This is the normalcy. When mind is very normal, the person will be very clear and happy. Prasanna alpendriya manaha. Mind is very clear. The person also will be very prasannam, happy, which is a natural state. So when mind is having thought process at a higher speed, it jumps from one point to another without your permission. Speed of the mind, movement of the mind, which is felicitated through the Vayu in Ayurveda. We know Pranasya Chitta Vahana. The Prana Vayu is responsible for through the Chala property, it is responsible for the movement of mind. When movement of thoughts are experienced at a higher speed, you understand that Vayu is too much in your body. That's why mind is running at a higher speed. This is the beginning of the dysfunctions of mind. Not disease, dysfunction, or deviation from the normalcy. When you understand that this is normalcy where you feel very comfortable, in different words you say relaxed, comfortable, not disturbed, not restless, not irritated, Chandam, Sadvrutta Nirtham. We call it as Vidyad Nityarasayana, which is very important to the name of this program, Acharya Rasayana. No? We call it as Shantam Sadvrutta Vidyad Nityarasayana. Shantam, that at peace with yourself, relaxed mood, which indicates that mind is having a thought process, one thought at a time. It's not running, it is just walking. It's not jumping, which is rarely happening normalcy, but majority of us, due to various reasons, have a running mind, running thought process. So I say when mind starts running, that is the beginning of the dysfunctions in the mind. Like we say dosha vriddhi. Vriddhi starts as the dysfunction in the physical plane, then only you get kova and disease. Like that, for the mind also there is a dysfunction starting, and that if it is not understood, we understand that we are not comfortable with this kind of running mind. Mind is focused and thoughts are coming slowly. You are very happy. Mind is not focused, thoughts are running without your control. You will not be happy. You will not be comfortable. You cannot be relaxed. Always an alert mode will be there, which is not comfortable to you. So you are not comfortable with yourself. That is the beginning of the dysfunction. Then we understand that, see, through the mind only you try to understand everything. When you understand that above the mind, there is a plane which is directly experienced. That mode of thinking is known as sattva quality in the mind. When you think that what is seen around you, the physical world is the real world, that also is understood through the mind, which is that mode of thinking is known as rajasi, or rather a perverted thinking, thought process. When you are not concerned with these things, what is there higher, what is there around you, you are not concerned, you deal with then and there, you don't think about it too much, that mode of mind is known as tamasi. Tamasam bhayam ajnanam. Okay. So Rajasic is almost a pervert understanding of the whole universe. Sattva is an understanding of what is actually really working in this world, what is really existing in this world. That is Sattva. So Sattva is always known as a guna to the mind, where you feel comfortable. Rajasic and Tamasic are doshas of mind, where it is vulnerable to be creating more and more troubles to you. So most of the mental disease we say sattva and rajas and tamas are aggravated and you are in trouble. Almost all mental disease we say. Mind is disturbed and through sattva, rajas and tamas, doshas, mind is getting into a permanent dysfunction, impaired function. This is the base of the mental disease. But when you look into the Samhitas, see the mental disease also. So I just wanted to convey the idea that mental diseases are not just physical diseases, and you don't think that the physical medicine will work always on mental disease. That is also a wrong understanding. See, when we don't have the clarity of mind and mental disease in our text, we depend on the Western books. I did it when I was a student. That's why I say, see, as per psychology, psychiatry, mind is physical and the physical medicine will work on that. But in effect, everybody knows that 80% of psychiatric disorders have no cure, no medicine. Even psychiatrists will be agreeing with that. So, but as per science, it is a physical plane, it's a physical medicine work. As per Ayurveda, mind is not a physical plane. So you cannot expect a physical medicine, dravya, to work on the mind. So medicine is not the basic requirement in the mind. You understand? Sutrasanam first chapter, we all know that Di Dairya Atmadi Vijnanam Mano Dosha Ushadam Param. Medicine is working, why should you say that? Acharya says, Di Dairya Atmadi Vijnanam. You must be having Di, minimum buddhi or understanding, capacity to understand, dharana, Di. Dhairyam, minimum courage. Courage is a normalcy. Absence of courage is known as fear. Courage you don't have to create. When you are in normal status, courage is a part of it. It's like, light and darkness. Light is a normalcy. Absence of light, you call it as darkness. It is abhava drivya. There is no matter known as darkness. When light is normal, what is existing, light is absent, you call it as abhava drivya. How light can be pushed away? You cannot push out the light because it's not existing. You switch on the light, darkness will disappear. That is a way. Mind also, you understand. That's why, there is a method in psychiatry where people try to say, what you say, you just advise yourself. For example, you want to quit smoking. You say, I don't smoke, I don't smoke. Okay, auto-suggestion. It is psychiatry, it is known as auto-suggestion. So you say, I don't smoke, I don't smoke, I don't smoke. But 1 or 2 days, 3, 4 days, 5 days, 10 days, you say, I don't smoke. 11th day, you will smoke. Because each time, you are reminding your mind of cigarette. How long you can keep away from that? Always you are reminded of cigarette. Then one day you will smoke. Few days you will quit, then you will smoke. So they know that auto-suggestion is not exactly working. Even though in the text it is there, it will not be working. Instead of that, suppose your mind is focused on something more relevant. The negative, the cigarette, goes out of focus. So you need to focus on the right thing, positive thing, whereas the negative can gradually disappear. It remains out of focus. It is not there in your mind. That is a better way. That is a way we need to look at it because our understanding is different. In this world, you have negative and positive. Rajasa, Tamasa, you have negative and positive. Sattvic mode, there is only one thing which is beyond negative and positive. That's why most of the solutions in mental diseases remain sattvic in nature, remain righteous in nature, where you see you will be trying to focus on what is really existing, what is the reality. So rest of the unreal things go out of focus. So when you look at the mental diseases as explained in Ayurveda, I would prefer to look into this Vagbhata, Ashtanga Hridaya, with which I was familiar. Even though it is there in Charaga, Susu and all, but Ashtanga is given a class. See, Ashtanga is a compilation of Charaga and Susu. Ashtanga Sangram, again it is compiled. Even then, Ashtanga Hridayam itself is not fully understood. Then we talk about studying bigger books. So I think Ashtanga Hridayam gives a classical example of how you understand the mental diseases. See, in Uttarasthanam, first there is a classification of mental disease. One is Bhuda, second is Unmada, third is Abhasmara. I think in my last class also I mentioned about Abhasmara. So that classification is very similar to how the modern science is classifying as neurosis, psychosis, psychoneurosis. Very similar to that, or maybe they could have got the idea from Ayurveda, how to classify the mental disease. Here we must understand how the Buddha Graha is manifested, what are your options to deal with that, how Unmada is manifested, how Abhasmara is manifested. So I used to say that everybody will be understanding. Hello, sound is clear? Hello,
Yes, sir.
sound is clear?
I think sound is clear.
Somebody was telling. Okay, fine. So I used to say that whenever the body is grown, Just like the body is growing, mind also has a growth. So when body becomes mature by 15 to 20 years of age, mind also gets mature. By that time, everybody tries to ascertain your identity in this world through a mode of thinking, how you should be behaving hereafter. All those things will be a concern for you when you become an adult, independent individual. So that time you must have a very good guidance, a comfortable atmosphere. Then your mind will be going in a very right direction. You establish a good thought process, and you will be basically you'll be sticking to, Satyam Savijamastikim Shuklavatma Rujirmati. Shuklavatma Rujir, everybody knows that the righteous path is comfortable. Righteous mode of thinking is comfortable. Everybody wants to do the right thing only, not wrong thing. Even if you do a wrong thing, before doing it, you will feel that it is a right thing. If you want to kill somebody, you will create a reasoning for that. So killing is judicious, right thing at that point. So you can do only the right thing because in the deep root of mind there is sattva. And doing a right thing, you feel comfortable and happy. So everybody tried to see that I will do only the right thing, I think rightly, I work rightly, I do only right things, I don't do the wrong things, I don't lie. That mode will be there for everybody. Some people will be successful in pursuing that for 5 years of pursuit. Sometimes you'll be very successful and you create a right character for yourself. So when you have a right character created, you will be pursuing that in rest of your life, and then others will call you as a personality. He is a personality. He's a right personality. So yes, he has been able to stick to his character of being righteous, right way of thinking, right way of doing things, everything in the righteous mode. So he is a successful person. Many people will not be able to stick to this kind of understanding. So they will falter on many occasions due to various things, internal factors or external factors. If you don't have conviction, you will compromise easily on many occasions, and external pressure will be there sometimes. To that also you will fall easily. What is the result? Ultimately, you may lack a strong character. Even if you want a character, you would like to have a good, strong character, but you will fail in taking a character. You will fail in creating a character for yourself. Factors may be many different things, external factors, internal factors. Maybe 20 years, 30 years back, then you say karma. Due to karma, you say 30 years back, how you dealt with yourself, then it is a past life. 10 years back, how did you do it? It is a present life. This. So anyway, ultimately you fail to create a character with which you are comfortable. A character for yourself, what you actually want, you fail in achieving that character. So you see that tamasic mode is, I think, he is not concerned about all these things. And sometimes he suffer, he will not suffer, sometimes he may suffer. That is not worth mentioning also as a successful person. So this person who fails in creating his own character and subsequently personality, suppose somebody is very particular of remaining very righteous, very strong, very comfortable, very religious, physically, mentally, he wants to become, and there is a strong urge for creating a good character, and he thoroughly fails, 100% failure. Then there is a seat of vacancy. There is an empty character, there is a vacant seat in that plane where unknowingly he may borrow some characters from outside. He can borrow a character without his knowledge and keep it inside. This is what is known as possession, or rather we call it as Buddha. The word meaning of Buddha is created. We say Panjabhuta and all. It's a knowledge of this world created. Panjabhuta, like that. Buddha is something that is created. It's not natural. You create a character, keep it inside, and we act as if you belong to that character. Just because it is not natural character, with that also you may not be happy. It is your own character, you'll be very happy. It is acquired character, you cannot be happy. This is what happens in Buddha, or rather possessive cycle. The importance of knowing it is that, see, you can have Sattva character acquired, Rajasic character acquired, or Tamasic character acquired. According to your requirement deep inside, character can be a Sattva character, can be very innocent character, like Gandharva, Deva, Grihas, can be a innocent character, may not trouble you. Whereas Rajasic characters sometimes may be violent, they may harm others, and we know that Brahmarsha Griha as well as Pitunmada are very similar. Violent, harmful, that's it. So you can have sometimes that kind of a character also. So Griha, 18 types of Grihas are mentioned by Vagbhata. It can be Sattvic, Rajasic, Tamasic also. The important thing is that doesn't belong to you actually. You have borrowed. You have created for yourself. So you don't get actual benefit of this character. Even if it is a good character, you are not benefited because it doesn't belong to you. That is the Buddha thing. Second thing, as far as treatment is concerned, we know that there is a limitation for clearing the physical body. Addressing the Vata Pitta Kapha, there is a limitation in Buddha. Don't think that medicine work. Other things, puja, homam, other spiritual activities and all are the solutions. If you closely go through it, those are the solutions for Buddha kind of diseases. Medicine will have a limitation on that because mind is completely involved in it. Mind is the reason for creating the disease, not a physical plane. So that understanding should be there. Otherwise, you give a medicine, you expect that this will change. That will not happen. Second thing, when you come to Unmada, where physical plane is also contributing to the disturbance of the mind, doshas, Vata Pitta Kapha are contributing to the disturbed mind, and mind also will be having a domination of Rajasic and Tamasic dosha. That means mind is not realistic. Mind is not Sattva dominant, hence mind is not realistic. Rajasic means perverted understanding of everything, wrong understanding of everything. So even for the understanding of happiness, you think that the physical world is real, and through the physical world you can become happy. Somebody is very particular that I should be happy at any cost, and I will 100% pursue the physical world, then I am in trouble. Everybody is pursuing happiness. That is available only when you become realistic. And this world is not realistic. We know that everything is changing every second. And changing things cannot be realistic always. So, but mind can think that what is seen is the real world. Through the real world, I can be happy. And I am very particular that I should be 100% happy. Then I am in trouble. I will pursue the physical world with the sense organs, 5 sense organs, thinking that I may get happiness. So from one point to another point, you'll be running in pursuit of happiness. At some point of time, your mind will be elevated to a plane of imagination only. Moving away from the realistic mode, you continuously remain in the imaginary plane and pursue different things and different locations in pursuit of happiness. Then mind cannot come down to the real nature. That status is known as Unmad. We say alcoholism. It happens, mind is elevated to a higher plane where you don't understand what is the real plane. So you feel temporarily very happy, intoxicated. So mind remains at a higher plane of imagination where everything appears to be comfortable. It's not actually comfortable. When the intoxication of alcohol is over, you again come down to the real plane where you deal with negative and positive. It cannot to that as if you feel intoxicated. You call it as madam, no? Vata Pitta status of body and Vata Pitta status of mind. It goes up from where if you look, you think everything is real, everything is happy. You are very comfortable in that plane, but actually it is not like. Through the body, through the physical plane, you get happiness through 5 sense organs. So each sense organ will be going after its own source. Whatever is seen, eyes will go that, whatever. In a Unmada condition, mind cannot coordinate that activity. So eyes will be going to one direction, ear will be going to another direction, nose will be going to another direction, tongue will be going to another direction, skin will be expecting another direction. So it is again, I think book says it is equal to Nashta Saradhivatirataha. As if there is a chariot pulled by 5 horses and controlled by a charioteer. Suppose the 5 horses are pulling the chariot to 5 directions and charioteer lost the control. What will be the result? It will not go anywhere. Similar to that, here your 5 sense organs will be moving in 5 directions because mind is not having an effective control. Okay. Very similar to that, you say you see something, you go to that place, then you hear something, you immediately move to that place. You don't know what you are doing. Somebody from outside looks, easily can understand. He is not coordinated. He will do something very strange or unexpected like that. So his activities can be very strange, unusual, unrealistic, very imaginary. And he acts as if he is happy. He is not really happy. So when mind is placed in a higher plane of imagination continuously like that, right? It is known as Unmadaha. Unmatta stage of mind continuously. Here it is important to note that, see, the Kapha dominant status, pure Kapha is a healthy status. Against it, the Kapha, you have Pitta and Vata. Pitta partially, Vata totally opposite. So Vata Pitta status is against the physical health. So it is totally against the physical health. It can also influence the mind in a negative way. This is what we need to understand. So Vata can be provoked by, Vata can provoke the mind. Easily we say Vata Vriddhi, Nidanas, you can see Chinda, Shogam, Bhayam, and all can contribute to the Vata condition. So Chinda is just excess of thoughts. You don't talk about anything else. In a resultant condition is not considered. Too much of thoughts are there, which is taking too much of movement of mind also. So mind also will be exhausted, which is very relevant nowadays. Most of the Vata Vyadhis, it is relevant. Okay. Most of the Vata Vyadhis, last class I talked about Vata Vyadhis. So we must calculate the Vata provocation through the mind as well while dealing with the Vata Vyadhis nowadays. Nowadays, I think people are mostly restless with the running mind. So Chinta can provoke Vata. Shokam is a temporary depressed state where thought process is continuous and at a higher speed. It's a resultant condition of thoughts coming too fast. You call it as Shokam. Temporary depression. It's not disease. Clinical depression is a temporary feeling of sorrow. You lose something, you lose somebody close to you, you feel down. It's not clinical depression. But even if you are down, you are quiet. Inside it will be with a lot of thoughts. So through Shogam also you can create a Vata aggravated condition, or Vata aggravation also can go towards excess of thought process. Then Bhayam. Bhayam is an acute state of too much of thoughts. Something strange happens, you take it to the mind. Lot of thoughts come together, result is fear. There are also physically the number of thoughts are relevant. Vayu movement is relevant. Fear, shock, everything. So I used to say I had a case of a bike accident boy, aged 29. He had a bike accident. He went into coma for 2 days. After third day, when he came out, his mind was without control. Almost schizophrenic. He wanted to kill his mother only, nobody else. And mind went out of control because of this acute shock or fear, whatever it is. Through Vayu, mind became so restless. And since he didn't have a clear understanding of what actually the status of mind, how it should be comfortable and all, he was, through the work, he was stressful. So mind was not very healthy for some time. So he went into a disease mode. It was almost schizophrenia, violent, wanted to kill his mother. He was treated with 2 courses of treatments, and I think continuous talking. Even with the help of my student, we were able to manage it and he became totally normal with 2 courses of treatment. I used to talk to him continuously. He became normal, now he is leading a normal life. So it is possible, when you understand that Vata can provoke mind, there is a treatment for Vayu. Then for the mind, you need to talk to him. Talk it out. What is troubling the mind, that you need to talk it out. That is the thing. So Vata can provoke mind. That is one thing. Second thing, Pitta. Kopa Pitta. That also, we say the worst enemy of a human being is Kopa, anger. Okay. So Krodha is contraindicated many conditions. Chantam, Sadvurta, Niridam is a healthy status. Shoga, Krodha, Bayodvega, Vega, Shraddha, Vidarna, even for Garbhini. We say Krodham is not good. Not good for the child. Not good for the fetus. Krodham, wherever you see, the Dakshabmana Sangrudha, Rudra Nishwasa Sambhoga, Jwaraha. That is the first disease in this world, initiated through this Lord Shiva, who is getting angry. Through that anger, the presence of heat is created. Through the heat only, the inflammatory process of damaging the body started, and that is inevitable also. When it comes as a disease, it brings the death at an early stage. Even otherwise, the body is damaging systematically, where the process is inflammation dominated by the heat, released through the anger. That is the meaning of it. So Pitta also can create, or Kobam can create Pitta. Pitta conditions you can see easily. Anger is the very similar to what you say. Rajasam Bahubhashitvam Mana Kruddamba Malsa. Rajasa people can have anger that is not controlled. It can create Pitta atmosphere in the body, or Pitta can create a Rajasa atmosphere to the mind easily. Even in an anger state, agitated state, 2 things are relevant. One is the speedy thought process which is happening in the mind, which we attribute to Vada. Lot of thoughts you have not addressed, you have not understood that it's not comfortable to you. So through that, you allow the mind to have running thought. So after some time, that plane becomes weak. Then you are vulnerable to the emotion of anger. It is connected to the Pitta atmosphere because the result is that you create an extra heat, Ushna property in the body, which can be damaged only not only for the body but for the mind also. For mind also, you can have Vata Pitta condition damaging the mind. Unmada, the Vata Pitta atmosphere in the body is very much important. Addressing the Vata Pitta condition in the body, pacifying the Vata Pitta condition in the body through treatments of Panchakarma will be partially helping to reduce the impact of Unmada. So if you understand that Unmada, you have an access to deal with the physical body, then deal with the mental plane. That will be more effective. And Buddha, physical plane may be very healthy. You don't require any dosha involvement in it. Dysfunction in the mental plane alone is responsible. Third condition is Abhasmara. Abhasmara also we say Rajasa, Tamasa, Doshas are responsible for that. And what to say, the memory is completely lost in that acute state. And you are, so I used to say, we all know that this is a neurological condition. Epilepsy is a neurological condition. But provoking factors are mind. Rajasa, Tamasa mode of mind, where you get a wrong understanding, pervert understanding of this world, and your pursuit of happiness, everything is same. So in certain areas, when your mind is not very realistic, you will be pursuing certain things which are absolutely wrong, but you will strongly pursue, thinking that there is a result for that. Absolute wrong plane, when you strongly pursue, it will not produce a result. And when you understand that, mind can come to a standstill. There is no expected result, but you strongly pursue it, and mind will be just stopping at it. When mind stops, the Vayu also can stop for a while. Because prana says mind stops, Vayu also can be stopped at a small fraction of a time. Then the result is that Vada related activities of the body can be halted for a second, which is almost known as seizure disorder. Seizures, all Vata related activities you can see. So it can happen even to a newborn, it can happen, even to aged person can happen. Since the major impact is on just forgetting what has happened. Abhasmareti. The smriti is lost. That's what is known as Abhasmar. Smriti is actually connected to the higher planes of mind. Mind is completely under dysfunction. The memory is lost. That's why the name is given. And it's explained along with the mental disease. The reason is very clear. Provocation comes from the mind. Even though it is a Vata disorder, the provocation is coming through the mind. Vata atmosphere will be there in the body. So whenever Ayurveda people are dealing with Abhasmara, by giving medicine, by reducing the incidence of Abhasmara, you need to ensure that mind is also brought into the normalcy. Things are discussed, talked, and clarity is created. Mind is also pacified, so that then only your work is complete. So 2-3 things, 2-3 diseases are explained in Samhitas. Some of the Buddha conditions may be mimicking the Unmada. You call it as Buddha Unmada as well. And most of the medicines like Panchagavya Gridam, Bhudarava Gridam, Brahmi Gridam, or even Kalyana Gridam, Mahakalyana Gridam, Dhanvantara Gridam, you see that Kushto Unmada Abhasma, Unmadam Abhasmara, everything is indicated. Bhuda, Mada, Abhasmara, everything is indicated for a typical medicine which is usually practiced, utilized in mental disease. So we understand that medicines are creating a healthy, clean atmosphere in the physical plane where the movement of mind can be smoother. Movement of Vayu can be smooth. Through that, mind also can have a smooth thought process happening, which can contribute to the well-being of the mental disease. Rest is your work. So please don't think that the medicine will do everything. Like allopathy, allopathy medicine is working. Ayurveda, intellectual use of medicine is working. Prayogasha medvyadi. What purpose you are using, how it should be followed with that. For example, I used to say that nowadays, there are very few people without having anxiety, agitation, restlessness, and irritability. Or rather, people are not aware about what is the comfortable status of an individual. How do you remain comfortable? How do you give rest to the mind? How do you know that like body needs rest, mind also needs rest? When you are overusing it, we say due to work stress, I am stressed. So external factors may be adverse, sometimes against your calculations or opposing your calculations. Work may be too much of a multiple focused work and all. Multiple tasks are common nowadays in all works. So mind is highly utilized. Intellectual works are too much, but you must know how to give rest to the mind. Mind is rested. Mind is not rested. Naturally, overused mind will be gradually showing some dysfunctions, which will ultimately lead to disease. So these dysfunctions are there in anxiety, agitation, restlessness, anger, irritability, all those things, these all are very common nowadays, which is not a disease. Because it is not a disease, people discard that. But Ayurveda people can understand very easily that mind is being used, mind is allowed to run, even though it is not comfortable, it is not in your control. You don't recognize that it is not a comfortable status. So doctors have to talk about it and convince them that you are not comfortable with yourself. Then what is a normalcy of mind? Convince them reasonably, logically, then try to bring to that level along with any kind of Vata disease. To my experience, most of the conditions nowadays, this is very common, like thyroid or PCOD, all those things. We all know that the hormones are coming from the brain, FSH or TSH, not from the respective areas. So when brain is having an extra pressure, stress, anxiety, how do you expect the hormones to be normally secreted in normal time? It cannot happen. So you need to look into that plane also in such new diseases, latest diseases, or while dealing with the health of anybody in the present day. To my experience, after 95, I used to say this, that people are not generally happy, people are more weak even in the physical plane as well as mental plane. So first thing is that you need to discuss and create an awareness of what is the normalcy, what is the comfortable status. Then you need to discuss about, give medicine to soothe the body. Soothing the mind will be a clear, open discussion with the patient and bring them to the normalcy of the mind. Convince them about what is the normalcy, how good, how comfortable, how relaxed it is. When you are convincing them, This is what is known as nowadays counseling. So Ayurveda people have a very big stake in dealing with many of the diseases. Even a low back pain, and I got a low back pain from Apollo Hospital. It was stress-induced. They had do surgery. He came to me, and I could not do Snehasweda in first 2 days because he was not able to sit and lie down. He was not able to, he was totally restless, no sleep. Sitting was difficult, lying down was difficult, movement was difficult, everything was difficult. And I did a Snehapana in the 3rd day. 4th day he slept off. Then only I could start with the Snehasweda. And after doing the Snehapana for 3 days, I did Snehasvedam and Vasti in a proper way, induced it carefully. We don't think that just doing Vasti or Snehasvedam is our work. That's the work of a therapist. How effectively you are inducing to ensure that the disease is addressed, result is created. So whatever is done, Snehasvedam Vasti is done, then every day 1 hour talk to see what is the normalcy of body, what is the normalcy of mind, what is there beyond mind, how this world is working, how you look at this world, although things are nothing but a little spiritual knowledge, those kind of, Deshakala Atma Vijnanam Jasadvrutasya Anvartan. Anulpati Samasena Vidiresha Pradashita. Nijagandu Vikarana Ulpannanam Chashandaye. Those who, to prevent diseases, Nija or Agandu, as well as diseases which are manifested. What is actual medicine? Deshakala Atma Vijnana. A knowledge about himself, knowledge about the patient itself, you need to create. That is possible when you have a knowledge about yourself. This is what is known as Vedic or Upanishad understanding. When you understand yourself in a complete way, it will be easy to convince the patients of how you are. What are your planes, physical plane, mental plane, spiritual plane, how you remain comfortable using all these things. Those things we need to discuss. That is actual counseling in our Ayurvedic thing. So the Atmadi Vijnanam is about oneself. You need to say what are the different planes of an individual, how you keep it healthier and comfortable. This is our requirement. So I say whenever you treat Vata diseases, you need to see the role of Vata, how mind is restless, irritable, anxiety, agitation, irritation, frustration kind of things you need to see. Any disease in which Pitta is dominant, like for example, I always used skin diseases or Pandu. If diagnosed Pandu, rarely diagnosed, Vata Rekta, where the Rekta Pitta connection, if you go very deep, you see that the mind is equally involved. Wherever the mind is involved, we say diseases are either autoimmune or there is no medicine. Psoriasis, lichen planus, rheumatoid arthritis, any arthritis, there is no medicine, it's all autoimmune. Autoimmune means you are creating an atmosphere for the disease, you are supporting the disease. Your support can be analyzed through Ayurveda, it also can be addressed, that's what I say. So even in dealing with the normal diseases, you need to see whether the Vata Pitta atmosphere coming through the mind, then medicines will have a limitation. Medicines will not create absolute result all the time. Then that stage you need to look into the mind. That also needs to be addressed, partially through medicine, partially through the talk, creating an awareness of mind. So we have an extra stake in dealing with any disease which is considered to be incurable or autoimmune. Say many diseases. Number of diseases, I don't say the number. We know that as per Ayurveda, it is innumerable. As per modern science, it is numbered 1256. As per Ayurveda, it's innumerable. So you need to expect all the time new diseases. But the way of understanding a disease dysfunctions in the body, dosha pattern, or the involvement of mind. Deep analysis you can pursue. So if you can have an understanding of this depth, you will pursue, and many more incurable diseases will be treated successfully by Ayurvedic people. With these few words, I think I have closed my time. Let me conclude it. Whatever idea I have got, I didn't try to just reproduce the book. I just tried to put up what is my understanding of mental disease, how that understanding can be applied in normal practice. And with that, let me conclude. Now it is open for the questions answer session. Dr. Ramya? Hello?
Hello. Namaste. Sir.
Hello. Namaste.
Thank
Can
you,
I
sir.
conclude? I think, yeah.
Thank you, sir. Thank you. So I think before we move on to the Q&A session and discussion, for you to take a few minutes of voice rest, I'll call upon Dr. Rashmi for the product presentation. Dr. Rashmi, please.
Yes, ma'am. Thank you.
Meanwhile, I request all our participants to please post their questions in the Q&A session, the section not in the chat box, so that we can record that and document that. So that's a request from us. Please do post in Q&A session. We'll be taking up the questions later. Dr. Rashmi.
Welcome to the product presentation. This is our 100 years of healing legacy, Sitaram Ayurveda, 100 years of healing legacy. We are having a wide range of products. Today, I would like to go through few of them. First is Kalyanaka Kritam, mainly indicated for Abhasmara, psychic disorders, Vandyada, Smriti Daurbalya, learning and disability disorders, and cognitive disorders. Dosage is 5 to 10 gram. It is presented in 150 gram bottles from Sitaram Ayurveda. Next is the Manasavitram Gulga. It is mainly indicated for Unmada, Abhasmara, Vaktosha, Vishujika, Madha, Murcha, Anidra, stress and anxiety. We are having both Gulika and Gulika tablets. Dosage is 1 to 2 tablets daily. Next is the Kautacha Triphala Lehium from Sitaram Ayurveda, mainly indicated for Pandu, Kushta, Jwara, Pleha, Asridhara, Gulma, Tamakashwasa, Harshas, Shukradosha. Dosage is 5 to 10 gram. It is presented in 100 gram bottles. Next is the Swapna Sap. This is a patent medicine from Sitaram Ayurveda. It's well-known tranquilizer, Jadamamsi, Tagara, Kushta, and Sarpagandha, along with the brain tonic Mandukaparni and Vaja. It reduces anxiety by relaxing CNS and enhances mental alertness and calmness, and improves duration and quality of sleep. It prevents and repairs brain damage, and is very effective in insomnia, anxiety, and other psychotic disorders. Dosage is 1 to 2 sh. Swapnasap tablet, the 100% herbal support for mind and brain function from Sitaram Ayurveda. Next is the Shiva Gulika, the mighty Shilajit Rasayanam from classical Ayurveda, potentiated with Jivaniya Ghanam and Gomutram. It is this will be the pramanam as mentioned in the text. Very effective in metabolic, liver, spleen, and urinary disorders, and diabetes complication, including impotence. Dosage is 1 BID with warm milk. Sitaram Shivagulika, the ultimate Shilajit medicament in its original size and efficacy. Next is single herbs. The richness of singular herb remedies now made available for healthy prescription. It's more potent, carrying 600 mg extract, packed in plant origin vegan capsule, glass bottle packs of 60 capsule. It assures easy absorption and strong action. We have Amla, Ashwagandha, Brahmi, Gokshura, Gulgulu, Kabikachu, Shallaki, Shadavari, Tagara, and Triphala. Dosage is 1 to 2 BID. Sitaram single herb, the safe, curative, and health supplement for regular usage. Next is a Yoga Amritam. It is a new venture for young doctors to know about special yogas. It covers the major ingredients, indication, Rasaguna Viri Vibhaga of each drug, along with the clinical experience regarding that particular yoga from Sitaram Ayurveda senior most faculties. To receive the notes of Yoga Amritam in your WhatsApp, please send a text to 81388888932. I repeat, 81388888932. To know more about Sitaram Ayurveda, log on to our website www.sitaramayurveda.com. And also please note, we are sending e-certificates to all the participants who attend this webinar for more than 75 minutes. And we are sending the notes and recordings to the email ID with the registrant used for the registration by the subsequent Saturday. If you could not find that mail in your inbox, please check your spam, promotion, social or career folder. And please our email ID to your contact support@sitaramayurveda.com. And please send your name, location to the following number of Sitaram Ayurveda to get all updates, links, and notes of Acharya Rasayana via WhatsApp. 8943441881. I repeat, 8943441881. And for any support from Sitaram Ayurveda, please contact Mr. Rajiv, our Customer Relations Manager at 9072613194. I repeat, 9072613194. And his mail ID is crm.osk@sitaramayurveda.biz. And that's the end of my presentation. Thank you all for the patient listening. Handing over to Ramya ma'am.
Thank you, Dr. Rashmi. So I think today's Jayakrishnan sir, as he mentioned, that at the end I have talked about my insights and clinical experiences from his own thoughts. And I think some of the highlights that he mentioned was how he introduced that a person who has to be having an understanding about darshana and yogam before coming to Vaidyam, and how Manas is actually the bridge between the Purusha and the 5 Indriyas, and how actually, and I think the specific clicking that I had was the emotional mind and the intellectual mind, the emotional mind being more closer to the physical body, and the intellectual mind being more closer to the Purusha that he was mentioning. And Chintyam being the basic, when we say Chintyam Vichari Mukhyam Deyam Sankalpam Evacha as the Mano Arthas, Chintyam thought being the basic content, and all others like Uhyam, Vicharim, etc., and extensions of Chintyam. And when basically dysfunction of mind happens, it's important that we think about the Vata Kopa, the aggravation of Vayu that can be at the background, and where we have to be aware about what exactly is the normalcy of mind with respect to the comfortability, no restlessness and all that one experiences. And the so-called sattva, which sir has explained as the mode of mind. So it's not just mind, rather the mode of mind, which definitely can be classified as sattva, rajas and tamas. As body grows, mind grows, and one becomes aware of the traits of the mind. And it's very important that we realize that everyone is actually on the path of doing things, or supposed to be doing things in the righteous way, which is actually more towards the sattva or sattvika sattva, which is actually the real essence of the so-called Purusha. And how he described, I think, the 3 psychiatric or psychological or related with Manas in our Shastra, the 3 areas, Bhuta, Graha, Unmada and Apasmara. Bhuta, the possession of mind, wherein mind is more involved, physic not. Unmada, wherein both the physical issues along with Manas is involved. And Apasmara, even though neurological presentation is there, the starting or triggering could be an issue with mind. I think concisely these are the relevant issues or relevant points that sir has highlighted in his talk. So I'm sure that we'll be having a great interaction with Jayakrishnan sir on the questions. So sir, I think primarily, before I take up the questions specifically, what do you think should be the dinacharya as an experienced person? I would say two things, sir. As an experienced physician, as an experienced teacher, what should be the good dinacharya of a Vaidya so that his mind is good, according to your thing? And what exactly should be the dinacharya of a normal person? As you know, today's world stresses, targets, living on behind comforts and conveniences, etc., should be the dinacharya of a normal person for having a good mind.
Dinacharya you leave. Vaidya should be more aware of what is the swastha, symptom. How you can say that you are swastha? You remain as much as possible in your swasmin sthiyade, natural state. How you can remain? That is healthy status. Then physical plane, how you make it? Dinacharya contributes. Getting up Brahma Muhurta or earlier. Before sunlight, when you get up naturally, the sun also can contribute to enlighten the mind. Buddhi Meta Abhimanadir Sadhana Sadhagamurgadam Pitta. Buddhi is enlightened. So there should be some light, no? That's why you say before sunlight, you get up and receive the sunlight, which can have an impact even on your buddhi. Body, you call it as pitta, Agni related. So the Dinacharya is basically meant for having a disciplined body, physical status, which can contribute to a comfortable mind. For the mind, naturally, you must have a little spiritual mode. Spiritual mode means you must have an understanding of yourself. You must try to understand who you are. This is actually known as spiritual. When you try to understand what am I, what is my body, what is my mind, what is controlling my mind, and I say my mind, what is myself? Naturally, when you look inside, instead of looking outside, when you try to look inside, understand inside, it is a journey which will end up with understanding who am I. This is what is known as Vedic understanding. So an effort to that itself makes you spiritual. Everybody need not reach the ultimate level, but an effort to understand makes you spiritual. You understand that, see that P.S. Vaidya or Vaidya Madam or even Coimbatore, the key physician, they had their own temples. Why do you require a temple? To ensure that religious, spiritual kind of things will ensure that you are pacified in the mind. With a pacified, relaxed mind only, you can understand things in a depth without having a deep, quiet, comfortable shantam. That's it. In what word? You don't have equal to that. And with the mind which is in a shanta mode, you can have understood things in a very big clarity. So which is a must for a Vaidya. So you see Ragadirogan, it's not a physical thing which is meant. Raga is when you think the physical world is the real, problem lies with your mind. And then physical objects you feel attached. That is where you are prone to use it again and again for your happiness. So the root is on the attachment your mind creates with the physical world. That is how you are prone to a disease. That is how we say. When you realize that the physical world is unreal, something deep is real, you remain detached. That is the actual solution to the disease. First, physician should know that. Then only you can talk to give some light on these kind of understandings. Need not be the exact thing, but some light on this kind of an understanding to the patients wherever it is relevant. First, you must have a comfortable mind. That's what I say. Prasanna Alpendriya Manaha Swastha Ityabhidiya. Prasanna Atma, Prasanna Manaha, clarity of thought. So mind should be very disciplined and comfortable. Physical discipline can create through the Dinacharya, Rduyajya kind of things and Shuddhi, medicines, Ahara, Vihara. Mind, it is a pursuit of knowledge about yourself. Instead of looking outside, like science, they try to understand everything outside. Ayurveda, you need to understand everything inside. Once you get a picture of what is there inside, same understanding you can apply on the patients as well. Even for dosha, if you understand dosha status in your body, because it is understood through the mental plane, same can be applied to the patients also. It's not an objective observation, no? It's more a subjective observation. If somebody is, you feel hot, first you must understand, when I feel hot, how do I feel? Then only you will ask this. We are not talking about temperature. Feeling of heat where pitta is elevated. Feeling of heat in the mind. Body heat is felt in the mind. That can be understood if you have already experienced that status. You have analyzed and understood what happens when pitta is increased in your body. Then it becomes subjective. Easily you can visualize on other people also. That is very much needed in mental conditions. Physical disease also it is needed. Even doshas, I used to say it is not very physical. It is understood through the mind. So mental conditions definitely. If you understand how your mind is working, it need not be normal. How your mind is working, how you are not comfortable, then only you can visualize same thing on a patient. So a deeper knowledge to the physical entity, mental plane, if possible, beyond the mental plane. That's why idam punyathamam shastram. If needed, beyond mental plane also, people can go through Ayurveda. If needed, it's not a must. So that's fine.
Yes. Thank you, sir, for the beginning. So in between, I'll take up the questions. I think Dr. Sharada had asked about, I believe like how our body has manas, Aushadha also has manas. Both collectively maintains physical body. Your view on this. Also, she asked about the nidana for all diseases, manas, like manas make us to take some ahara, vihara, etc. So your view on this statement also.
Yeah, definitely. See, body is Panjabhuta, medicines are also Panjabhuta in nature. So they can have a direct impact on the Tridoshas, which are nothing but the functional entities of Panjabhuta. So physical plane can be easily corrected through the physical medicine, Panjabhuta medicine. But some medicines can create a perfect conditions of imbalance, address the imbalance of doshas, and a perfect healthy condition can be contributed. Naturally, that will be good for the mind also. Last class also I told, ghee is one of that. So you call it as prabhavam of ghee on the mind or in all spiritual activities. Why we add cow's ghee? It resembles the perfect physical health. Prithvi, Jala, and Agni in a perfect combination so that Vayu can move in a comfortable space created by Akash. This is Panjabhuta. So ghee can create that because it contains Jala and Agni plus Prithvi. Prithvi is a matter, Jala and Agni are opposite. One is Shida, one is Ushna. But they coexist in the cow's ghee, which is very rare. Whereas milk, you see only Jala is dominant. So we say Shlashmala. It is also healthy, but it is not Deepana. Whereas ghee is Deepana. So Agni is also there. So body is Prithvi, Jala and Agni. Nothing more than that, so that you can do all the activities. So ghee is considered to be very perfect for the body. Most of the diseases, ghee is the medicine. It is Vata Pitta Haram. Hence, naturally good for mind. Most of the mental disease, Snehapanam with ghee is advocated. You have all the ghees available. Just now you presented some ghees like Kalyanakadam and all, no? So ghee is the ultimate medicine in the physical thing. Similar to ghee is gold. Gold also has got Prithvi, Jala and Agni in proper proportion. So we say gold is the best rasayana, Anga Bhasmam. All gold you cannot remove from the ritualistic. See, you decorate any deity. Gold is the best thing. Highest temple and all, you see the gold crown. Recently, somebody submitted to Guru Ayur, no? Gold crown. Why gold? Gold represents a physical perfection. Naturally contributes to the well-being of the mind, which is very much needed. So in Ayurvedic language, we say Vata Pitta Kapha or Prithvi, Jala and Agni is fairly represented by these two things. Otherwise, generally, Jala and Agni together cannot go. With medicine combinations only you create that. In single drugs, you cannot have it. Second thing, if the physical plane is so perfect, it can have an impact on the mind also. Then you say prabhavam. Krida has a prabhavam, milk has a prabhavam on mind, papanashanam. Papa, again, you know that papa is something you do against yourself is papa. That's why the papa is mentioned. Last class I mentioned, that's why I didn't repeat it. Most of the mental disease you say papa. Chidram papa kriyaramba bhago anishtasya karmana. You are giving an opening for the mental disease by initiating, deciding to do a negative thing. Any activity which goes against the absolutely positive status. Okay, so that becomes papa. Papa, you need not steal. You can even think of stealing. That itself, mind you are turning against yourself. So it becomes a papa. Kaya vang mano bedena trividam apedanga. This you can even convey to a normal person, intelligent person, no? You can even talk to a person. This is how mind is working for everybody. Why should you keep your mind against yourself? How to focus to the, how to see that mind is focused today. Somebody has, I think, asked about Hanuman Ali's, how it is working in fear psychosis. Any prayer, see, in the deity, you have a general understanding, imagination. Then the understanding of God, which is considered to be absolute. When you apply your mind to that one point, the most important part is that mind is not running. Mind is confined to one point, unpointed attention, harsh devotion, then persistent striving. This is required for everybody to remain comfortable inside. That one pointed attention can be created through bhakti or any mantra. Because you have an understanding of what is Hanuman. So mind will be easily sticking to that. Then the meaning of mantra can gradually creep into your mind. So mind will be confined to that area. It means that it's not running away. That is what is required. So naturally, it can create a natural status for the mind, which is against the fear. Normally, mind, I told you, no, is courageous. Absence of that normalcy is fear. So slowly, this you can explain asking to do it. That's what I say. When we understand that, we can tell this is what is happening. Through bhakti or mantra, you get a one point attention. Your problem, the whole world is that mind is running away, running with thoughts. So when mind is, there is a way to bring mind to one pointed attention. Why can't you do it? Provided the deity should be convincing to you. Any form of God. If you are convinced, if you are fond of it, that's fine. I don't say this deity, that deity alone. Any God form which is comfortable to your understanding is fine. So mind will be sticking to that. Mind will be confined to one point thinking. It indirectly means that mind is not running away. Fine. So I think medicine can have an indirect impact on the mind. We say Ratnas, Mani Mantra Ushadis, Chetna Ushadis, Vaja and all, we say it can have an impact on that. When it creates an impact on the body, indirectly it can have an impact on the mind also. Otherwise, directly, we must be very clear, mind is not physical. So medicine, physical medicine will do wonders. I think that will be an incomplete understanding. In between, we will stop it. After some time, again, it can come back. So complete, when you say, when you deal with something completely, you must have a complete understanding of it, how you are doing it. Then the mind should be understood as a metaphysical thing, where awareness, knowledge creates such. Okay.
Okay, sir. Okay. So there, sir, then as you mentioned, the so-called like Nidra is one of the important aspect that indicates, the Manas is with the Atma and sensorium. I mean, the link between the Indriyartha, Indriya and Manas is cut during Nidra. And as you mentioned, when we are all in Nidra, we are basically in Sukhavastha. So in many clinical conditions wherein there is loss of sleep, as we understand, especially there are, aged individuals who especially, I think specifically with neurodegenerative issues like Alzheimer's, dementia, Parkinson's, and spectrum of Parkinson's plus cases, etc., wherein there is explicit loss of sleep, no sleep even during the daytime, especially people who are aged amongst us. And such instances are increasing in our society, in our families also. So in that context, how can we understand what's happening with Manas and how can we exactly deal such cases, sir?
Yeah. So Anidra, you need to see due to physical reasons, Vada Vriddhi, it is there. So all Vada Vyadhis, you need a loss of sleep as a condition, as a symptom. Even Pitta also Alpa Nidra is there. Okay, Pitta aggravated condition also, mind will be working. So mind becomes alert, you cannot relax. When thoughts are reduced, brought to zero, then only one goes to sleep. When thoughts are running, you cannot sleep. The thoughts are running just because Vayu is there inside. So if it is a physical condition, see, Hidamatyagni Anindrebhyo Kiriyo Mahisham Hima. Why Mahisha Shiram is indicated? It is more /malam or it's more Vadaharam. Shiram itself is Nidra Jannam. So it increases Kaba, reduces the Ruksha nature of Vayu. The Vayu movement becomes smoother, then mind becomes smoother. Indirectly it can contribute. Not that everywhere milk will work. Suppose the mind is working too much, you become alert, then Nidra will be issue. May not have a physical disease also. You become too alert or use the mind continuously for years together, too much, beyond your requirement, or you have not addressed the mind, you have not rested the mind knowingly, mind becomes, this alertness become a habit, then you cannot sleep. In that conditions and all, I said, then it can create a Vata Vyadhi. I told you, back pain with stress. Such conditions, instead of going for any other thing, we straight go for some Snehapan. In that mostly create in the body, sometimes Vayu is suddenly pacified, then he may sleep for some time. Then once he is relaxed, little pacified, you need to talk. What we discussed in this class, you need to talk to the patient. There's nothing wrong in that because Ayurveda is a colloquial language, it's not a technical language. Whatever we discussed, it can be understood by even an ordinary intelligent person. He is a seeker, he is interested in learning, this can be conveyed to a normal person, any educated person, I think he can understand. So it's not a technical thing. So this is where we see Vada creates a physical atmosphere like alchemy. Alzheimer's, any brain-related activity, you see the mind getting involved. In stroke, patients are depressed usually. Alzheimer's or this kind of any degenerative, neurodegenerative diseases, you see you are irritated, irritable, restless, sleepless. So something in most of the Vada Vyadhis, I used to give a little Kalyanakritam or Brahmikritam based on his atmosphere, along with whatever is needed to do it, to see that mind is also pacified a little. Then we need to talk to them in a friendly way, create awareness of what is happening inside. Then I think it is producing more result.
Thank you for that, sir. I think Dr. Sangeeta Jadhav had asked about which Deha Prakriti is more prone to Manasa Vikara. Any observation in that context?
Okay. Deha Prakriti definitely. India, Didoshaja. Didosha Prakriti, especially Vata Pitta Prakriti, is very bad. Vata Pitta Prakriti means always you feel negative. Even the body and the mind. You feel I am bad, I am weak, I cannot pursue, I cannot go forward. Always negative impressions will be there in Vata Pitta. Kapha Prakriti is sattvic and very healthy, very courageous, very strong. Kapha Prakriti is mentioned. Didosha Prakriti is very bad. Third thing is in Tridosha itself, Vata Pitta is negative to your physical health and mental health. I explained that. Like Rajasic and Tamasic properties will be more in Vata Pitta. Whereas in Sattva, you see only Sattvic nature, you can see only in Kapha Prakriti. So in general, Didosha Prakriti is bad, vulnerable. Kapha Prakriti, you see physical diseases are less. Whereas Vata Prakriti, 80 diseases you need to expect. Vata Pitta means physically you are weak, mentally also you are weak. The other thing is that I think because of the time, it is Kaligalam. Generally, people are going down physically and mentally. Everybody is going down. So the more you get awareness about what is mind and all, you are in a better position. Otherwise, you are vulnerable. I think, to my understanding, 90% of people are not happy. Whatever they get, they are not happy. It's not a problem with what you get. It's a problem with how you look at it.
Okay. I think you're muted, sir. Hello.
Yes. When you say Vata Pitta, it is negative, physically and mentally. When you say Prakriti, it is by birth you are getting an atmosphere which can be complemented by your activities, even mind and body. You know that when your body is Vata Pitta, you can be careful not to have diseases. That's why Dinajatya, Ardhajatya kind of things, Mind also, when you realize that you are not comfortable with your own mind, then you discuss, you find a solution to that. So 50% is there by birth, 50% you complement your status so that you feel more comfortable. Sugam, which is the purpose of life. So when you understand that this is your requirement, then only you try to look in that angle. So even if by birth it is Nija Prakriti, need not be affected sometimes. Need not take it into the mental plane. Even if you have a disease in the body, why should you get affected in the mind? When you are aware of that, you can come out of it easily.
Okay, sir. Okay. I think many have asked about again autism and ADHD. How to understand Manas in that background and how to deal those cases in children.
Yeah. Nowadays, I used to say ADHD, autism, autistic, attention disorder, different grades of same thing to my understanding. Okay. Attention disorder, attention deficit, autistic, then autism. I think even the first autism patient I have seen, it was reported in Austria, it seems. And that boy happens to be in Coimbatore when I was a teacher there, 92. That time in India, you didn't have autism as a major issue. No autism was reported in India. Now it is very common. Okay. So autism is the highest grade of that category. Even ADH and hyperactive, irritable nature, attention deficit, all those things, child cannot explain what he feels. That is a big issue, but we can understand. So, and to my understanding, all these things, here the Ayurveda knowledge has to be applied very naturally. See, the mind also is growing when the child is in the womb. Second month onwards, fetus also starts getting the feeling of Sugam Dukkam, according how the mother feels. So third month onwards, mind becomes gradually independent. It starts feeling all emotions that the mother feels. And it will be complete in the fifth month. When the mind is completely grown, you get the full effect of it in the 5th month. That means 3rd, 4th, 5th month, mind is traveling here and there between the mother and the child. And the 5th month onwards, child will have its own mind. So what kind of mind you are transferring to the child? That is important. And are you aware of what is a normalcy of mind? How you should be in the pregnancy? How you should be in the 1st and 2nd trimester? If that is understood, advised accordingly, awareness created. You know, olden days we say once you are pregnant, you should be treated like a Rani, queen. Why? Even if something wrong you desire, Tauhurdam you say, it has to be given little. Because Shraddha Vigadat Garbhasya Vikrita Chudireva. That kind of a desire you cannot block. But it comes from the mind. So because it comes from the mind, you cannot block it. It can provoke for you and sometimes it may be dangerous. That's all. So in that stage, see 3rd, 4th, 5th month, how mother is keeping her mind, that mind is getting transferred. If you are under stress, tension, irritable, agitated and all, due to various factors, we say blame, father-in-law, mother-in-law, that atmosphere, this atmosphere, but that's not an excuse. That mother will be transferred to the child. When child comes out, what happens? It need not be a healthy mind. It can be a disturbed mind. First symptom of the disturbed mind is withdrawal. Mental disease, psychiatry, they say, you tend to withdraw. You cannot mix up with people. All hyperactive autistic children, whenever new people come, they withdraw. They go back to their room. They don't mix. They don't talk to you. Withdrawal is a basic symptom of depression. Their mind is actively running. Hence, they can have a vada atmosphere. We say in the nervous system, it can be weak. Through the mind, they can create a vada atmosphere. No disease. Whatever the symptoms can be there. So, what is the way to address? You can address only the vata atmosphere in the body, which can have an impact on the mind. So, what I used to say, first thing you need to educate the mother about it. This is how it would have happened. Basically, you can clarify how you were. Are you were normally kept or you were disturbed at that time? Otherwise, he will deal with the child in a rude manner. It's not going to work. If mother is created awareness, now at least he can deal with the child in a better way. You can distract, you can, avoid confrontation, avoid beating, anything you can avoid. Even if you beat and all, child will not come back. That is the reality. So many situations he can avoid if she is getting a good awareness. Second thing, I used to do Navara continuously. Navara, very young age, if we get it, Navara Lepam, otherwise Navara Kiri. Every year, at least for 5 years, 6 years, you say. It's not, don't expect instant result. Do it 1 or 2 years, it becomes calm. Attention deficit and all easily managed. Disorder deficit, even speaking difficulty, it will be easily managed. Internally also we used to give Saraswata Gridam or Brahmi Gridam, very small dose, 1 or 2 drops. Aristas we give to see that basic health is kept intact. So Navara we used to advise them. We say how this is working, how our understanding is, based on what Navara you expect. Gradually, when we know that brain is growing, 60% of the brain growth is there up to the age of 6. When you give a support, that growth can be healthier. Another 20% up to the age of 12, another 20% up to the age of 24. So any stage when you do this kind of Vata treatments, especially Navara, Shashtika Pindasvedam, it can reduce the Vata atmosphere or it can contribute to the growth of the structures everywhere, not only brain, entire health structure can be healthier, thereby reduce the impact of Vayu. Then create awareness to the parents so that they will not take it in a negative way. They can also keep in a comfortable atmosphere gradually as much as possible. Then I think autism is the highest grade. All other things are almost same. But in the rest of things can be, even acute autistic condition can be reduced. We have done it. I have taken classes for the parents of an autistic school. They are keeping 25 autistic children. Is a hostel, or they are dealing there for last 30 years. After they create I think they train them in some job, some technical job, like in a shop. They will help to put up a shop, how to write the accounts, that alone they will be known, how to give the things, take work in a store. That work alone they will be trained. Then they will be sent out. Like that is possible. So there I used to take classes to the parent to think that to help them through the mental plane, to make them comfortable as much as possible. So that is possible. I used to say, to my understanding, ADH, attention deficit, attention disorder, autistic, autism are in grades, gradually increasing grades. If you don't do it, role of mind is there, but the physical plane, most of the disease of the young, Navara will be a wonderful thing. It can create a best kapha, pure kapha, and Vata will be pacified. In polio and all, no, just Navara payasam is enough. Need not give a medicine. Navara payasam in acute stage is enough for polio and all. So this is what I used to do, autism and all. And 92 onwards, autism is there in the world. Now in India also, it is a big concern where there is no direct solution. Many places we used to do certain kind of thing when I was in the college. Autistic children we used to do. Now also I'm doing some free treatment for autistic people and all.
What treatment, sir?
Yeah.
Treatment.
Ramanathan sir, you would like to?
Yeah. Now you can, Jason, what treatment, sir? We are a really experienced man, so please help us. We are also facing the same problem. Please.
Autistic.
Please help.
Yeah, definitely. Repeated Navara, I say either 2 weeks, at least 10 days every year. And if adult people are there, Matravasti is given. Medicines based on what is their complaint, to that we address and we create a comfortable status inside. Then Navara Kiri or Navara Tepa, and after 10 and all Matravasti, at least 4 or 5 Matravastis are given. This has to be repeated every year, at least 4 years, 5 years. I think definitely there will be a change. Autism, I don't say reversal, but where there is no solution at all, no, you see a lot of qualitative changes in it. Attention deficit and alertness and all can go down. Violent nature, autism, when it becomes 13, 14 and all, you can become violent. They give Rivotril kind of medicines, allopathy people, no? You cannot control. But those, I think, conditions can be well controlled if you are putting continuously Navarakiri and Matravasti.
Okay.
Jason, I have an experience regarding the autism cases. 2 cases. That is some control also. Mainly that is the internal piles. So I asked you to give the Pipilyadi Anuvasana Xylem. So this continues the Pipilyadi Anuvasana Xylem. Immediately the patient is cooled down. So I have no idea what is the reason for the patient is cooled down. I have 2 patients now. They are very experienced. Pipilyadi Xylem, yes, Anuvasanam.
Okay.
As Matravastila, sir.
Yes, Matravasti. My experience, sir.
No, this is where I say physical plane, if he's adult, physical plane you need to assess, you need to find out from where the Vayu is supported, And there is a history of Arshas and all. Vasti, either Vasti has to be limited. I used to give this Chirulyadi Kashayam with Brahmi Grida.
Very good.
So internally you make a correction, then you go for any kind of Vasti. Even Pilyadi Vasti will be fine. Or even then Sajara, once you give internal medicine, the what you say, the Mamsanguras will be shrunken, then Vasti will be easily accepted. So background atmosphere, if there is a Vata nature from where it is coming, we need to pursue in our way. To that we need to give some medicine. Then only whatever you do as Navara, Shastika Pindasvedam externally will be working. If internal correction is not made, I think other things may not be working. Internal correction, you have more options. Even if it is autism, diseases we can pursue like Arsas, as you said rightly, Adisara Grahani or Pandu, Gulma, kind of things has to be pursued. These all are contributing to the Vada nature. So that also needs to be addressed with internal medicines. Then externally Vada treatment, whatever we are doing, Shastika Pindasvedam will be showing the result.
Okay, sir. I think I also remember when you were mentioning about Chirulvadi Kashayam, Tirmul sir always used to say treating Nunmadan case with the Chirulvadi Kashayam. And in that aspect, you were mentioning about the Vayu Popa and Manovikara are directly related at many stages, which we may miss at many points. So yeah. Sir,
I used to say the basic symptom of arthritis, not pain or bleeding. Anavasthidatvam is mentioned in Ashtangriti. Anavasthidatvam is restlessness. You become restless in the mind because of the Vayu going up. It can have impact on Pranavayu. Then it can have impact on the mind. Your basic symptom, no disease, but you become restless, irritable. That is anavasthiti. Avasthiti you don't like. Anavasthiti is a basic symptom of first. That's why it is a Maharoga, not an anorectal disease.
That was a point, sir. Arshas, because I do in many discussions we have senior physicians who are mentioning about whenever there are some kind of psychiatric issues and all, it's Chirulvadi and Dusparshagadi, that's the first choice, and the new gen think about Kalyanagam, etc. in that spectrum, that's not the way that we have to approach it. So, sir, by coming to that aspect, as you mentioned, Gritham is one important thing that we can prescribe in this area. So, we do have Kalyanagam, Paishachika Gritham. I think commonly available Kalyanagam, Mahakalyanagam, Panchagavyam, Mahabhudarava, Paishachika Gritham, commonly. So, in your experience, the different situations wherein you will be applying these, either as Shodhananga or Shamana, your guidelines on that.
So I used to say Kalyanakam, you know that Panduvamai Pipeda Kalyanaka Hoyam Panchagavi Mahatikam Sridam Varagudadina. So when you get a clear picture of what is Pandu, I am a Mamalam Levanani Madhyam. Pitta provoking things are the Nidana. But you don't see Pitta in Pandu. Okay. Pitta, Ushna nature of Pitta through Nidana, you are destabilizing the Kapha. Kapha, which is almost all Dhadus. So the Kapha nature or the Snigdha nature of all Dhadus are destabilized. Astira. Or you say Abhishan. It can be in the dissolving mode because of Ushna nature. So Dhadus become weak. Pure Snigdha is not there. Impure Snigdha is there. So the weak Dhadu, in other words, you say Vada. So Nidana is Pitta. What is seen is on Kapha related Dhadu. And naturally, the result is Vada. Vitiated Snigdha is filling everywhere. Vayu movement is disturbed. So Vada difficulties are there. You need to expect Vada Vyadhi or mental disease, anything. Unmado Vada Vyadhi Vishesha, as per Charagano, it's Vada Vyadhi. So what is your solution? Whenever you give a medicine in Pandu, you need to pacify Vayu, where you are giving Snigdha things. Snigdha will not be accepted because Kapadushti is already there. Or if you reduce Kapa, for that you will be giving Ushna things, which is also not good in Pandu. So your situation is that you can't use anything directly. So it becomes very difficult to address the background atmosphere. So what we do is, that's why the Adimadikritam is the first medicine as per Vagbada, as per Charaka. The Adimadikritam, the medicines we know that the Adimad Kuduvam, Danya Kuduparum, Pellir Tabalatahi, Chitraga, Sringi Veraja, all strong things are there. Krishna things are there to address the Kapha actually. So Kapha is dissolved, dried up, Vayu movement will be encouraged. That's the thing. And Siddham Utpandu Gulmasha Pliha Vata Kaparpin. Indication itself is Vata Kapha. So through medicine you are trying to address the Kapha. So Vayu movement will be felicitated. Vata Haram also happens. But it should be a Girda, so that it doesn't go against Pitta. That is the purpose. So you address Kapha, which can create a Vada and Lomanam without provoking Pitta. So when you address Kapha, unwanted Kapha should not be created. Like milk creates /malana, too much of Kapha. It should not be there. So a Kapha support should be created, where Snigdha is induced in a limited way, which can reduce the Rusha nature of Vayu. So Vata Kapha treatment will be very good. And if it is ghee, it cannot go against Pitta. In that, first thing is Kalyana Kritam. Without increasing Kapha too much, you can address Vayu. Proper Snigdha content can be induced. So if it is little Pitta dominant, we say Panchagavya. If it is Pitta actually dominant, Mahadittam. It is Kapha dominant, Araguda. That is how the medicines are mentioned in the Pandu. Same thing we can use in Unmada also. Unmada also, physical condition you are addressing through the inducing ghee. So Kalyanakam will be a typical medicine. Without increasing Kapha, Snigdha can be induced, Vada can be subsided. And because it is ghee, Pitta impact also can be reduced. If it is Pitta dominant, aggressive, agitated and all, I used to go for Brahmi Kritam. That's good. Everything contains medicine which are good for the Medha, Medium and all. Most of things are there. But Brahmi is, it is little more Sodhanam, which is good for Pitta also. So, Panchagavyam also creates Srodha Shuddhi. So, wherever earlier he asked, fear kind of things are there, fear psychosis is there, Panchagavyam used to have a better impact. Understanding of Kalyanakam, little more fortified, you say Maha Kalyanakam. Or Panchagavyam, where Srodha Shuddhi is very much needed. You address Kapha, Pitta, Vayu everywhere, but Srodhanam is very much needed. Panchagavyam will be a better option. Just pacifying, keeping the health, Kalyanaka Kritam will be a very good option. Or Pitta aggravated, anger, agitation, kind of thing. It can happen even in nurses. Agitated anger and all. Brahmi Kritam is widely used as per my understanding. Is that fine?
Sir, I ask you a different question. I think you are the right person. That is why I raised the issue. That is Trigadu, Tribadu, Shesha. That is a Kalyana Sharam. But why the name is a Kalyana Sharam? We are always, you had mentioned number of the Kalyana Ghee, Kalyana Kashayam. But the RSS, it is only mentioned the Kalyana Sharam. But nobody is prescribed in their mindset.
So Kalyanaka Charam, Trigadu, Tribhudu Sreshta, then the Rushkara Chitragam, all Tishna Ushna things but Jarjaram Snehamutrata, ghee is added to see that the Tishna nature of Kalyana Sharam is not creating trouble. So with the ghee only, you create the Kalyana Sharam. When it is given also, in ghee we need to give it. So that Kalyana Sharam is actually meant for the Mamsanguras of horses. Shara Prayogam, you know, Mamsa Vriddhi Rogas are to be addressed with Sharam, Agni, Karma, and all. So the Sharanguras, Mamsanguras are actually shrunken with Kalyan Sharam. That means Mamsa increased, Mamsanguras shows a Kava increase effect. It can shrunk. At the same time, Tishna nature can provoke Vayu. That's why you need to give it with ghee. So Pitta, Kava related Mamsanguras are shrunken without provoking a Pitta nature, hence creating a Vadanulomanam. Especially the most important Mahasrodhas, Koshta. What else is needed in the health? In Ayurveda, you don't require anything else. All those things can be achieved which is carefully used. That becomes Kalyanakam, Mangalam.
So what is
Kalyanakam.
the dosage form?
If it is carefully addressed, you can address all the three doshas. It is carefully induced, typically needed in us. Many diseases you need these, but arsas typically you can expect. Mamsanguras are shrunken, Pitta is not provoked, Vayu is going down. It implies a healthy status for the individual. So it is a, what you say, Shubham, Mangalam, Kalyanakam. That's it. Kalyanakritam also does the same thing. You say, what is that? Alashmi Kalinashanam. Even is good for Papa and all. That means mind becomes clear. When physical plane is made healthier, mind becomes naturally pacified. Then you can have an impact on the mental plane also.
Beautiful answer, sir. Beautiful answer. Thank you.
Thank you, sir. I think a few more questions we'll take. Is it okay for you, sir?
Yeah, no problem, no problem.
Yeah, I think we do have many questions. So what's your opinion on psychotherapy in Ayurveda? And also role of, I'll combine 2 or 3 roles, yoga, pranayama, etc. in dealing with Manasika Rogas, and also the role of Deva Vabhashra Chikitsa.
Okay. So this is psychotherapy. What I explained is psychotherapy in Ayurveda. Okay. In that, if you take little more deep, the Shaddarsanas, yoga is one. Through the Yama, Niyama, Asana, Pranayama, and all those things, you are actually regulating the Vayu, Prana. Vayu movement is regulated through the body, mind gets partially pacified. That's it. This is actual yoga. You have different, different yoga cults. I used to say, different people induce yoga in different moods. A lot of, I think, traditions are there in yoga. Nothing is wrong. Some people do it intensely, some people do it slowly. Some people teach and do it. I am in connection with most of the yoga people, Sri Devi Shankar, Amritandamayi, Satyananda Saraswati. I know a lot of people, Chinmaya Mission and Brahma Kumari. Different people are creating different traditions, but all are aiming at how the mind can be disciplined. This is our concern while dealing with the mental disease. Ayurveda also. So yoga is not strange to Ayurveda. By controlling through the mind, you are controlling the Vayu. Ayurveda is controlling the Vayu by creating healthy physical structure. Beyond a physical structure, Ayurveda, yoga, I told you, Sangya is the root of Ayurveda to my understanding. Sangya creates a better understanding. Sangya explains how you are working in this world every second. This is Sangya. So it is a reality. So how your mind is working, how vayu is working, everything you understand. How you manifest into the gross form from the subtle. So yoga is a way to take your awareness from the gross to the subtle. It also aims at yoga chitta vritti nirodha, how to reduce the thought process, how to slow down the mind. So meditation, dhyanam is there, no? How mind can be regularized, disciplined with reduced number of thoughts, or even can be brought to a standstill, or you call it as samadhi. In our this thing we say turiyam. I told you, no? Turiyam, where you are alert, you are not sleeping, but the mind you don't have any thoughts. That is in yoga, it is not a samadhi. So you are also aiming at disciplining the mind without anything done on the physical plane. It does create health in the physical plane so that your aim is to control the vayu. So mind can be regulated so that you can go beyond the mind. Yoga mokshakarana. Yoga mokshakarana. Among the mokshakaras, yoga is best. So to go beyond the mind is the purpose. For us also, dharmarthakama mokshanam arogya moolam uttamam. So ultimately, yoga is a exercise in the plane of mind to see that mind is disciplined and you can sublime beyond the mind, which is the purpose of life for everybody. Unfortunately, majority of the people do not realize that. That's it. So yoga will go always with Ayurveda. Certain other thing I told you, no, Sankhya is the root of all Ayurvedic understanding. Among the Shaddarsana, Sankhya remains closer to Ayurveda. Bhagavad Gita says, Sankhya Yogayor Abheda. Sankhya and Yoga are not different, same. That Sankhya remains the basis for Ayurveda. So it goes together while dealing with mental disease, definitely little yoga to your comfort zone. Not that everything for everybody. To your comfort level, yoga, different aspects, yoga can be induced by yoga expert. That can be suggested to go very well with Ayurvedic dealings or Ayurvedic understanding. Ayurvedic language can be understood by yoga person. Yoga language should be understood by Ayurvedic person as well. Both can go. They work from the plane of mind. We work from the plane of physical body. Both are going towards the same aim. Okay.
Sir, yes, sir. So then about your opinion on Deva Vibhashra Chikitsa and its role.
I think it is a very deeper question. Still, I will try to make it. See, Deva Vibhashra Chikitsa is something you depend on Deva. What do you mean by Deva? That is a bigger question. The absolute status of the universe or an individual is considered as Brahma, which is beyond physical entity, which is beyond everything, in spite of anything, you can say. But that can be personified. Then only you feel convinced, this understanding you are taking through the mind. So the absolute nature is beyond everything in this world, but it can be personified and you call it as Devata. So you can have, since you are understanding all these things through the mind and the mental makeup is, innumerable thought process. So you need innumerable Mupati Mukodi Devata. It's not one or two. You need many Devatas, but wherever you point to that kind of a thing, that is known as Deva Vipasana. Mind will be naturally more focused and it's not running in the innumerable objects of this physical world. This is what we are doing in actual spiritual. This is what is known as Alpa Vijnanam. This is possible. That's what I say. Whatever God you like, should be pursued. It's not that everybody is going to this temple, I also go. You don't have any effect on it. Whatever form of God you like, it should help your mind, definitely. And the God understanding in India is ultimately it is the absolute personified is God. So you can go to any kind of God provided if you like it through the mind, then your mind will be very well brought to one pointed discipline. You feel more comfortable. When you are in one pointed, you are closer to the Purusha. Then itself you feel more comfortable. That's why the moment you go to a temple, you feel comfortable. You don't require all this knowledge. Unknowingly, your mind gets stuck to that deity is one point. Then your mind is closer to yourself, which is comfortable to everybody. And as long as you are within the temple, you feel comfortable. So you encourage it knowingly. So any kind of religious, ritualistic, spiritual activities, ensuring that your mind is not running too much. Then you feel comfortable. Why don't you do it knowingly? When you do the same thing knowingly, it is not a spiritual. When you do it bluntly, it is a religious. That's all. Both will have its own impact. Both are contributing to your well-being in the plane of mind. So Deva Vyabhasa Chikitsa will be required for some people who cannot digest the depth of this kind of knowledge. So even bluntly going to a temple, I used to say, some heart disease, I used to say that in front of his house, there is a Shiva temple. I say, you just say hello there and go to work every day. He followed it for 3 months and I think his heart condition was almost disappearing. It happened. It happened. So he was a carpenter with less education. I said, you just go to the temple, say hello every day before you go to work. So any kind of religious ritual, spiritualistic work is targeting the mind to remain disciplined. Deva Vyabhasana, Yukti Vyabhasana, Sattva Vajaya, everything. This is the purpose. And Deva Vyabhasana is easily accessible to the public at large. So you can encourage that also, so that mind will be pacified. Or rather, you see in Dashavita Papa, we say, Himsastemanyadakam Paishunim Varshankam, Sambina Labam, Vyapatam Abhidya, Drigvibhari. Drigvibhari means, word meaning is that you don't believe in your own existence. That means you are against God, which can trigger any kind of prajnabrata, can trigger any kind of disease, physical or mental. Okay. So in Dashabhida Papa, it is included. That means you don't believe in your own actual existence, means you are against the Atma, Purusha. Thereby you are denying the God. It can create trouble for your mind. That's the meaning. So any ritual religious practices, Deva Brahmasam, Homam, Puja, all kind of things can create one point attention to the mind, which is wonderful and great in dealing with any mental disease.
Thank you, sir. I think I'll take up the last question, sir. Okay, it's already nearing 1 o'clock in the afternoon. So, sir, when we're discussing mental issues, definitely schizophrenia is one thing that is a very common one of the psychiatric issues. And I think approaching Ayurvedic people also, and many a times violent cases, relatives come and ask if you could manage, if they bring them, they will be already on drugs like Risperidone or Quetiapine, etc. So what's your experience and opinion on how to deal with these cases by a general practitioners? Can we confidently take that if a general practitioner who's having a clinic of 10 or 12 beds take up such cases, how to deal with that and how to understand the different avasthas of schizophrenia cases in different levels of expression? In short, sir, if you could do that.
Yeah. Generally, to my understanding, I think schizophrenia is the extreme level of mental disease. Generally, mental disease itself, Vadavyadi itself is Kritra Sadhyam. So mental disease are Kritra Sadhyam. In that, our understanding will be working. So in acute case of schizophrenia where risperidone or shock treatment is not done, definitely I think we have a better state. We have done it. As I told you earlier, one who got schizophrenic after the shock of a bike accident, he became completely normal. One who got a disturbed mind because he entered into a spiritual without guidance, his mind was totally put on that. He was put 2 times shock therapy and I could not manage it except 50%. I did it. But beyond that, I could not manage it. He's a well-educated engineer, in fact. So it depends upon when you do this kind of shock treatment or heavy medication, it creates an extra weakness to the brain, and then it is very difficult to regain again. Unnecessarily, you create a weakness, Fresh case, that kind of weakness will not be there. Whatever weakness is there, it will easily respond to our kind of medications, But wherever it is, ultimately, through this kind of panchakarma or snehapanam and all, you create a shuddhi. That is possible provided you have a setup required for that. And people having an understanding of it. When I was in the college, I used to have a lot of students, who gets a good understanding of what I'm doing. So they used to remain, internees and all used to remain as even bystanders for the patients. They used to go out, knock at the gate, 4 o'clock, 3 o'clock in the morning to take chaya vada. So students go behind them, keep them away from that kind of thing, distract and bring them back. So that kind of work they were doing. After some time it became normal. But you need an atmosphere parijaraka. Very clear. It is told in the book. You should have a parijaraka who has got a better understanding of what you are aiming, what you are doing. Then only mental disease can be easily, these kind of violent cases can be easily managed. In that chronic, those who are on medications for a very long time, I think sometimes it will be very difficult. Unmadam, I used to say Unmadam, especially Pitta Unmadam, is more difficult, but other conditions can be sometimes managed easily. If it is violent, you need a separate atmosphere. Other Unmada sometimes Manakandadi Nasana and all, sometimes you can manage well. Those who have a big loss of individuals or money, they also can go into the Unmada more, need not be violent, but those things can be managed better. With the condition is impact on mind, Rajasic, violent, you need an atmosphere to contain that. And once it is pacified, then only you can even talk to them. That also needs a better atmosphere, silent atmosphere, calm atmosphere. You need to have a atmosphere where your other works are limited. Then only you can talk to them 1 hour every day. It's not an easy thing. You should be comfortable. So in a general practice, I don't know how far this will work out so easily. It's not like giving some medicine and going away. You need to talk to them and convince them what is the position once they are pacified. Otherwise, they are vulnerable again. So 2 things. One is atmosphere, one is the people surrounding you also should have a better understanding. Then only it will be working, especially violent cases. But I think it can work. It is a fresh case. Sarvoshada Chame Dehe Yunaha Pumso Jidalpanaha. Sadhya diseases, younger ones, getting fresh, not chronic, any disease. You can have that kind of, I think you can create result. It's a question of how you create result. It's not a question of depending on medicine. Using the medicine, you are creating the result.
Yes, sir.
That's it.
Jason, so you mentioned that create the system. So can you help us? You can start one meditation, creation the steps for the video. So that is also you share to the youngsters. That meditation definitely useful the psychiatry. It's a mindful case itself.
Yeah. Definitely.
Okay, sir.
So
I think
when you expect it, sir, from the video. I know you are very busy, man.
Yeah.
Please help, sir, because your knowledge is depth knowledge. So this type of the knowledge, and you give our doctors. The doctors say to the patient. The meditation also definitely some harmful nowadays. Number of the YouTube meditations are available in but it is not the good one. So your experience, you can arrange one meditation part, sir. Please.
Definitely.
okay, sir. I think, sir, towards the end, I'll end with one more small questions. I think maybe the role of Murtha Taila, sir. Last question. Role of Murtha Taila, like Talapudichil and other things. In short, also, sir, the role of Nasyam in practice in these conditions, like how important they are, and as a practitioner is concerned, if we try to practice Nasyam every day, either to control the so-called Vayu, the Pranavayus, Rukshada, so that the Manas is in its place, how far will it be useful in your opinion and experience? Murtha Tailam and Nasyam.
Yeah. So definitely, I think I should have mentioned this earlier itself to ward off the misunderstanding. See, Murtha Tailam, Kaja Shatana Pinjaratum, Paripudanam, Shirasa Samira Roga, Janadi, Indriya Prasadam, Swarahanu Murtha Balanja, Murtha Tailam. Where is even Vada Roga? Kaja Shatana Pinjaratum, hair related issues. Paripudanam, Shirasa Samira. Shirasa Samira Roga, headache and all. Padika Shirasulam, Suryavartam, migraine kind of thing. Chedi, Janedi, Indriya Prasad. Indriyas, 4 of Indriyas are on the head. You get clarity for the Indriyas. So, eye disease and all, Murtha Tailam, Shirodhara, Shirovasti, everything is fine. Swarahanu Murtha Balanja Murtha can create a strength to the head. So, in my practice, I used to see that the Dhara kind of things, or Shirovasti, or even Talaputli. Talaputli is done for asthma or skin disease and all. That is a different understanding. Okay. Murtha Tailam is done complementary to what you do on the skin, which is the Vatasthana. It's the main Vatasthana. Pirichil Dhara. So, if you are trying to control Vayu, skin is the best place. Tuk is the best place. Complementary to do the skin treatment, Patrapola Sedam, Penda Sedam, whatever you think it is right for him. Kaya Sekam, anything. Complementary to that, you need to do it on the head because the sense organs 4 are situated in the head. And sense organs are Akshapravarti is attributed to Vayu. All sense organs are functioning with Vayu. So Vayu also can be controlled on the head. Sense organs become more clear. But to control the entire Vayu, head is not the thing. That comes from the understanding that mind is in the brain. Psychology. Mind is not in the brain also. So when you touch on the hand, you understand the touch means the mind is there even on the hand. Wherever Vayu goes, there is mind. The mind is there everywhere. Mind even can go out of the body also. Parakaya Pravesa. Yoga and all people do it. Mind can travel out. It's not confined to the brain. Among the anatomical structures, nervous system is the system on which mind is prominently working. But nervous system, how is it ending? It's just getting dissolved into the minute points of body. Center only is brain. All nerves are going to each and every point and then just getting disappear. So, and the second thing is that we know that axons and dendrites are the end parts of nervous system. Dendrites only can absorb the nutrient materials, even axons cannot. So dendrons are there actually on the skin, every hole. Nervous system is ending up in the dendron. When you apply oil with a lot of milk and all, dendrons can take it and transfer to the brain. Otherwise, brain nothing will go because there is a brain barrier. So even according to understanding of the modern science, skin is the best place to induce the sphincter content into the body to contain vayu, complementary to what you do on the skin or vasti in the large intestine. Complementary to that, you can do something on the head, oil application. That even for eczema, oil is applied on the head only. Eczema on the leg, where you stabilize kapha. Structurally, it is kapha sthanam, so vayu movement will be very smooth. So to stabilize the kapha, you can apply different oils. You know, in Kerala tradition, there are a lot of oils to be applied on the head. Application of head oil can stabilize pitta, vada, and thereby regulate the vayu movement. Pitta kapha can be addressed even on the head, kapha sthanam. So kapha shuddhi you can create with nasyam, or vata and loman you can create with nasyam, brahmana nasyam. But as a specific treatment, it is better done for the disease in the upper part of the body. But otherwise, like Panchakarma and all you are doing, in that vayu specifically in the upper part can be brought out, created and loman through nasyam, brahmana nasyam. I do Shirabella 101 nasyam and all, but provided what you do on the body is properly accepted, then nasyam will be in addition. Otherwise, nothing on the brain is well protected, nothing will enter straight to the brain. Everybody knows, and mind is not the brain also. Mind is not a brain. Mind is working on the nervous. That's all. Mind is different. Brain is different. That's my understanding. So do it carefully. What is told in the book is actually for the hair, nose, eyes, indriyas and all, not for even a Patshagata kind of a Vadagya. Samira Rogan is Shirasa Samira Rogan. Vadiga Shiru Rogam or Vadiga, you can have Nasa Rogam, Vadiga, or eyes, or Timira, eye diseases with Vada nature. It will be more effective. In a mental disease, Shirodhara is not the primary option. Even Vasti done in a very proper way can have a better impact. Vasti is done in a very proper, calculated way. Vasti can control the Vayu, the entire body. Then Abhyangam on the whole Vadasthana will be the best thing. Whether you have a knee pain, back pain, or neck pain.
Thank you so much, sir. For last 2.5 hours, you are here with us. So I, towards the end, sir, thank you so much for all your insights on various topics, especially when we have been discussing Murda Dailam in many contexts, where in Indriyam, when it is mentioned, Indriya, Ubhendriya, Manas is an Indriya, and Shiras is a Indriya. So definitely procedures have got a role. And your insight into it, that it is important that the Koshtam gets corrected and then moving on to Shiras as an adjuvant process. I mean, Shiru procedures as an adjuvant process has definitely added on to the different thought processes. Even every point that you had mentioned had a takeaway message, sir. So thank you so much for your discussion. So towards the end, I call upon Ramanathan, sir, for the concluding remarks. Sir, please.
Sir, Jayakrishnan, before conclusion, I put one more trouble for you. Still more than 197 participants still there.
Yeah.
Why? Because the subject is fantastic, interesting. Okay. So my humble information, I wanted one information. That is how Remya started the Ragadi Rogan.
Yeah.
So why the Acharyan only mentioned Aulsikya Moha Aradi Jagana? what is the concept of the mind? I think that every research papers I saw that more than per day, 40,000 of thoughts daily rising in our mind. So
Yeah.
maybe this Sausika Moharari. So I think the new generation, they are not get correct answer or translation of about the Aulsikya Moharari. So before conclusion, please help us, sir. What is the Aulsikya Moharari?
Okay.
Definitely helpful, sir.
Aradi is restlessness, definitely. Moham is a wrong knowledge. Shankaracharya says in Salsangati, Nisangati, Nisohati, Nirmohatvam. Moham is a perverted wrong knowledge. Nirmohan should be there. Then only you go towards a level where you feel self-realized, which is known as moksha. You realize yourself, which is known as moksha. So for which you need a disciplined, calm mind. Aulsukyam is also an over-interest you show in certain things, Moham is a wrong knowledge. Ragam is a root of that. You think what is there in the physical world is real, mind will be naturally going towards that. So with that only you start getting something wrong in the physical plane. So Aulsukya Moha Aratita. These things, wherever mind is not calm, it can start running, and the impact you call it in different names. You say anxiety, restlessness, irritability. Reasons may be different, but if you understand that, in spite of the disease, you can remain calm. That has happened. Many great people had many diseases, but they were very quiet. Many big people had big diseases, but they were very quiet. So that is possible when mind is quiet, mind is relaxed, comfortable, then only you have an option to go beyond mind, which is ultimate aim of every individual, whether you realize you agree with it or not. Knowingly or unknowingly, you are going towards self-realization. I must know what I am. Then only I can have a living knowingly. I can do everything knowingly, then I'll be happy. I can eat knowingly, then I'll be happy. I can walk knowingly, then I'll be happy. Everything you are doing knowingly means you need to sublime from the mind and a plane which is living here. So you try to realize it throughout your activities. This is not only mentioned in Ayurvedic book. Shankaracharya very clearly says, whatever you do is a puja to the self. Soundarya. So whatever you do, the person is living. So it is a puja to self to make him happy or remain in happy mode, which is the nature of the self as per Vedas. Prajnanam Brahma, Prashena Jnanam Brahma. As a happiness is there only, so everybody is pursuing happiness means everybody is unknowingly pursuing the self-realization. That is why Deshakala Atma Vijnanam is ultimate solution. When you know what is your body, then you will pursue only what is good for your body. Bad for your body will be discarded if you know that. Like that, for mind also, you must know what is good for the mind, what is wrong. What is right for the mind, what is wrong for the mind. If you know the mind, you understand what is right, what is wrong. So ultimately, you are trying to know what is your mind. Why do you know what is your mind? To remain happy. When you know what is your mind, you can sublime above the mind. There, you remain automatically happy. This is the understanding. So mind-related different conditions, Yobasha, Dvasha, Maisari, Raga, Dina, all those things, you say whoever is addressing these issues, Yo Abhurva Vaidyaya Namostas. Very interesting thing is that, see, even for Lord Shiva, there is a synonym as Mahavaidya. Not only Dhanvantari, even for Shiva, there is synonym as Mahavaidya. You can see Vishnu also as Vaidya. Vaidyo Veti. Vishnu is Vaidya. Dhanvantari is Vaidya. Everybody is Vaidya in that plane, and even Shiva has a name Mahavaidya. So you understand, that is the aim. So you need to get rid of the clutches of mind. In the mind only you get Aulsukyam, Moham, Arati, all these things. So clutches of mind you need to remove. Body should be made cleaner, healthier. Mind should be made pleasant. So that ultimate aim of life you are achieving. So whatever is needed for the body, we say medicine, treatment, daily rituals, daily routines, and what is the Hrudu, Charya, everything is there. For mind, what is there? For mind, these kind of knowledge will be working. So the mind can be brought to a comfortable level where if you are interested, you can go beyond the mind, which is ultimate purpose of Ayurveda, yoga, or anything. Or unknowingly, that is the purpose of life for everybody. So this will work, this understanding will work for any individual, which is very much required nowadays. Sorry, is it okay?
Fantastic, Jason. So, Ramya, I don't want a detailed conclusion. I put in one word, Jayakrishnan is our Apurva Vaidya. Apurva Vaidyaya, Namostu Tasmai, sir. You have done good job.
Thank you.
Good.
Thank you.
No, you are giving good knowledge, sir, regarding our how to work to patient and realize. And accountability also, you have mentioned that. So without the accountability, mindset of accountability, our diagnosis tool is not perfect. So you are very clear, that is one coin. One side mind, other side Sharira. Fantastic, sir. Beautiful.
Yeah.
Well done, sir.
Thank you, sir.
We need more support from your side, sir, future also. We'll trouble for again.
Definitely.
Waiting for your...
Yeah. So we had the second session from Jayakrishnan sir in our series, and we definitely would like to have more. We'll definitely be coming back to you, sir. So thank you, Ramanathan sir. Thank you, Jayakrishnan
No, I
sir.
am waiting for his video. That is a webinar, series of webinar regarding the mind pool effect. Please help, sir.
Yeah. So you have
Yes, sir.
promised in a public platform, Jayakrishnan sir. So definitely you have to come out with it. Thank you all. We wish a very good Sunday. Thank you, Jayakrishnan sir, once again for the insights and enlightening session that you had with all of us. And I'm sure the audience, each one of us might definitely are enriched by your vision. May God bless you. As Ramanathan sir mentioned, Apurva Vaidyaya Namostu Tasmai. Thank you all. Thank you. Namaste.
Thank you all very much for the patient.
Thank you, sir.
Thank you.
Thank you. Thank you, sir.